Howdy. Welcome to the Texas A&M University College of Veterinary Medicine and Biomedical Sciences Peer Program's STEM Education Series. Today, Dr. Michelle Coleman will present Horse Sense, Equine Internal Medicine. The horse is a unique species. He is neither a ruminant like the cow, nor a simple monogastric like the dog, and his amazing power and athleticism are due to a highly complex musculoskeletal system. For these reasons, among many others, the horse often requires a doctor with specialized training. And that is what Dr. Coleman is here to discuss with us today. Welcome, Dr. Coleman.
Good morning. Thank you, Tori, and thanks to each of you for your attendance today and your interest in equine veterinary medicine. This morning, I'm going to talk to you a little bit about, first, my background, and specifically why did I choose veterinary medicine and why equine internal medicine. I'm going to talk a little bit about how to become an equine veterinarian, a little bit about the day in the life of an equine veterinarian, and then specialty veterinary medicine. And specifically, I'll talk about some of the case examples that we might encounter in an equine internal medicine hospital on a daily basis. And also discuss some of the career options and things that can be done with a degree in equine veterinary medicine specifically. So to start, I'll talk a little bit about my background. I've always been a horse person and always had an affinity and a love for the horse. I don't really know where that came from. Nobody in my family grew up around horses or even liked horses that much. But for some reason, from day one, it was something I was always very passionate and interested in. I rode as a young child and always really just, again, enjoyed being in the presence of a horse. During school, however, in high school and even middle school, my favorite subjects were always science and math-related topics. Certainly English and geography were okay, but my true love was science, and I really thought at that point in my life that I wanted to go into some sort of field of medicine, and it was human medicine that I was actually drawn to at the time. Even though I liked being around horses, I thought that my skills in science would be most utilized as a human doctor or a nurse or something in that nature. I took training courses in things such as I became an EMT and rode around in ambulances. I worked in emergency rooms, I worked in the OR, and I worked as a nurse's assistant in many different hospital settings. Those were always things that I really enjoyed doing, but for some reason there was still just something missing. During college, I spent some time working just for fun with an equine veterinarian, and part of my reason for doing that is I spent lots and lots of hours studying science and doing lots of math and wasn't around horses as much because I spent so much time studying. So I thought maybe a great job to pay some bills would be to work with an equine veterinarian. And in doing so, I got to spend time in an ambulatory veterinary truck, driving around the countryside, seeing horses that you can see in this slide, foals, and helping horses on a daily basis. And quickly I realized that this was a career that had a lot of interest. And while this is the office view of many, the office view of the equine ambulatory veterinarian is sometimes much more spectacular. So this is the career choice I decided to go down. During my undergraduate education, I did a major in public health and microbiology, and that was a good basis and foundation for developing a science career and a veterinary education. Certainly that can be done anywhere. Lots of different state universities in Texas and throughout the country that can, again, be the foundation and the undergraduate education that would lead you to a veterinary career. From there, I went on to obtain a Doctor of Veterinary Medicine from the University of Georgia. And with a DVM alone, you can be a veterinarian of all species. That the day you graduate, you can go out and practice medicine on horses, cows, pigs, sheep, goats, birds, snakes. Some of those were a little bit more interesting to me than others, but certainly still the idea of going into equine medicine was my long-term plan. So when we think about equine veterinary medicine, there's lots of different things that you can do with that. On day one of graduation from veterinary school, you can go into private practice and be a veterinarian for horse owners and farms across the country. You can also go into other things, such as the military has lots of horses that are part of their service that have jobs on the front line and need veterinary care on a regular basis. There's things in public policy, making health rules and policies to keep the health and welfare of the horse sound. There's regulatory medicine type things, trying to, again, prevent spread of disease across our population. Other things that people consider in equine medicine would be education, teaching new veterinary students how to become a veterinarian in and of themselves. And then certainly research would be another field of investigation, that we're always trying to be better at what we do and improve the knowledge that we have about equine medicine to better improve the health and welfare of the horse. So again, the most common thing that people do is go into private practice, where they are the veterinarian for horse owners across the country. What does that look like? So lots of different things that a veterinarian does. The most common is probably just general health, that making sure on an annual basis, just like you or I would go to our doctor, the horse should be seen by a veterinarian on a regular basis, at least once a year, checking out the overall function of the different body systems and making sure that everything's working properly. Vaccinations, just like with dogs and cats and certainly with ourselves, are a big part of veterinary medicine as well, that there are lots of diseases that are contagious between horses or because of different insects and bugs in the environment that can spread disease. So regular vaccination of horses is also important. The horses are kind of unique in one thing, in that their teeth are constantly growing. So if you can imagine your teeth like they are right now, if they were this length today and 6 months from now they were twice as long, you can imagine how bizarre that could be. Well, that's what happens in the mouth of a horse. Their teeth are constantly growing, and so regular dental care is a really important thing. And one thing that we do is what's called floating of the horse's teeth. And what that word floating means is basically filing down the sharp points in the growth so that the teeth stay the same length and the same size and don't cause any ulcers or rub against the gums of the horse. So every year a horse has to have their teeth floated to keep them healthy.
I have a couple of questions for you already,
Okay.
Dr. Coleman. So the first one is, what should students who aren't around horses, who don't have horses of their own, what should they do to prepare for working with horses?
Great question. So what can we do to better prepare ourselves if we're not used to being around horses? Many people don't grow up around horses, but certainly still have that love and desire to be with them. So being part of a veterinary practice or going to horse farms and cleaning stalls, that's certainly what I probably spent my first 10 years of life when I was able to be around horses, was cleaning out stalls. And so getting comfortable with them and being around them, leading them from one point to another, feeding them on a daily basis, and getting accustomed to their needs and healthcare requirements and daily requirements is probably a good first step. There are many veterinary practices. I would say almost all veterinary practices very much welcome students of your age into practices to just shadow and monitor what happens on a daily basis. This happens very commonly in small animal veterinary hospitals, but equally commonly in equine practices, where you can jump in the truck and drive around for the day. And as I mentioned earlier, that's really how I started my first day in veterinary medicine, was that I jumped in that truck in undergraduate and rode around and saw what a veterinarian did, and from that point forward knew that was something I really wanted to do. So there are lots of those opportunities.
Perfect. And then one more, they mentioned that one of the things that horses need when they are seen by a veterinarian are vaccinations, and they want to know, do all horses need the same vaccinations?
That is a fantastic question. So the question, do we have a core set or a need for the same veterinarians for all horses? And there are, by the American Association of Equine Practitioners, a list of vaccines that every horse should get and at what interval they should get them. Examples, every horse must have a rabies vaccine. West Nile virus is a virus that's recently been introduced to the United States. Back in 1999, that became a problem in our country, spread by mosquitoes, and we can prevent it to the best of our ability with a vaccination. And so that's something that all horses should have twice a year. We think about that when the mosquitoes are worst, fall and spring times of the year. There are other encephalitis viruses that cause neurologic problems or brain problems in the horse that we can vaccinate against. And those groups of vaccines are the ones that we think about as the core, must-have in horses. There are others like influenza, the flu. Similar to you and I, horses can get the flu. The strain or the type that they get is not the same that we get, but there is a vaccination like we can get every 6 months to, again, prevent that spread of disease across the population.
Thank you.
Thanks. So thinking again back to what does a veterinarian do on a regular basis, another thing is look at lamenesses. If we think about what the horse does for a living, they sometimes work quite hard, whether they're a riding horse or a performance horse. Sometimes they work by pulling a cart through a town to take tourists through the area. So they often, because they work hard and have such a big, giant, important musculoskeletal system, become what we call lame, where they are limping on one leg or another. If you or I had a lameness, we'd say that our left knee hurts, and that would be pretty easy. But for a horse, it's a little bit challenging. They don't tell us what hurts. And sometimes, because they have 4 legs and walk different than we do, it can be hard to tell which leg is hurt. So the lameness evaluation is an important part of what a veterinarian might do, figuring out what hurts and where it's coming from. So once we watch the horse move and figure out what leg it is, we can investigate the different parts of the leg. Sometimes we have to flex the different parts, the knees and the fetlocks, which is basically like our wrist, and figure out what hurts when we flex it or bend it, and try to figure out what joint or what soft tissue structure is problematic or causing the pain. X-rays can help with this. So once we figure out where the problem is coming from or where the source of the pain might be, we can take an X-ray and see the bones and the deeper structures to see if there's something that's not quite right. And then once we do that, sometimes there are medications or a little bit of time that can help get these horses back to doing their job and doing what they need to do. Certainly there's always new horses. So one part of a daily life of an equine veterinarian out in the field would be helping to make new horses, and more importantly and more exciting to me is the babies that come. Being around foals is a spectacular thing. And so making sure that when a foal is born that it's healthy and it gets all the care it needs and that it grows properly through the first few months of life. Some don't have any problems and they do just great, but certainly others have a little bit of a struggle at first and they need some medical care and attention in those first critical few days that can help their life and help them get better quick. So getting a little bit back to my plan, again, I went to undergraduate degree, I got my degree in veterinary medicine, and then I didn't really know what I wanted to do with that. The idea of private practice, again, was always really fascinating and exciting, but it seemed like there was a little bit more that could be done and more things that I wanted to do. And for that reason, I went on and did an internship for 1 year in the beautiful horse country of Lexington, Kentucky. And there was a giant hospital that we saw tons and tons of horses every year, and they came to us rather than driving out to the farm. The most critical and most sick horses came to the hospital. So a very different side of practice than I just described and that I'd really been exposed to before. That was a fantastic experience, and so for that reason I went on and did what's called a residency in large animal internal medicine. This is quite similar to what we think about in human medicine, where when a doctor goes to medical school, they typically they must go on and do an internship and a residency in something specialized. So we think about specialties in human medicine. You might go to your family doctor, or you might go to the emergency room, and those doctors have very different training. Some doctors specialize in the heart, some doctors specialize in the respiratory tract, some doctors specialize in foot care. So there's lots of different things that human doctors can do, and similarly, we have branched and specialized a little bit, not quite as extensive, but some in veterinary medicine as well. My residency training was at Texas A&M University, and I achieved from that training a diplomat status by the American College of Veterinary Internal Medicine. And from there, I began a PhD program in the biomedical sciences. So why would I do that? If you add up all those years, you can see that there's lots of schooling that's gone into this process. But learning more about medical diseases and veterinary diseases and how we can research things to, again, make the health and welfare of the horse better was something that I thought I wanted to do, or I guess I do want to do because that's what I'm doing. So let's talk a little bit about equine internal medicine and what does an equine internal medicine veterinarian do and what does it look like? So I'm fortunate enough to practice in this hospital at Texas A&M University now. This is where clients from all over the state, and I would even venture to say the country, bring their sick horses for specialty care, things that the veterinarian in the field can't necessarily do. The tools, the techniques, the facilities, the personnel, we have lots and lots of help to sometimes get the job done. As you can imagine, sometimes with a horse that's 1,500, 2,000 pounds, it's not that easy to do some of the things that we need to do. It takes lots of good, qualified help to get that done. And so I'm fortunate enough not just to work in this place, but with these people. And the picture that you see on the right, this is the Equine Internal Medicine Service, including the clinicians, the students, the other residents that I now spend time training and helping become specialists as well. So what might we do in equine internal medicine? Lots of different problems and issues that we might see. Again, as I mentioned, in human medicine, the doctors specialize in different body systems. We kind of do the same, but really, if I had to sum up what is an equine internal medicine veterinarian, I look at sick horses. The sickest of the sick are the ones that we look at. And so this horse in this picture here is a horse that had some trauma. It was out in the field and it flipped over and was unable to stand up. And so it's supported in a sling and was in that sling for several weeks before it was able to move and function on its own. Again, as you can imagine, a horse of this size takes a lot of personnel and help to keep it safe and keep everybody else safe during that period of time. Horses sometimes have some weight loss for reasons that we can't quite explain. And so trying to figure out where does that weight loss come from. Again, they're not very good communicators, that they don't tell us that their stomach hurts or that they have this cough or something is bothering them. We kind of have to go on this expedition and figure out what's wrong and solve the puzzle to figure out where the problem might be coming from. GI disease is a big problem in horses. Their colon is gigantic, much bigger than ours, obviously. And it has a tendency to flip over and rotate within the abdominal cavity and get what we call a twisted gut. And for that reason, sometimes these horses get extremely sick and often or almost always need to go to surgery to help that problem. So in the period before surgery, certainly during surgery, and most definitely after surgery, they are extremely sick patients that need lots of intensive care. And then we can do lots of different things with different diagnostic tools. So this is someone doing an ultrasound exam of a horse's head, and lots of different things that we can do an ultrasound of. This picture here is someone doing an ultrasound of the abdomen of a horse, trying to see the different organs, the spleen, the liver, the kidneys, the GI tract, trying to get a good picture of them the best that we can. We're very limited in how much access we have to the horse compared to a human, that if a human had a stomach ache, they might put you in an MRI. The horse's whole body doesn't fit in an MRI, so we have to use the tools that we have and, again, put those pieces of the puzzle to the best of our ability. This is someone doing an endoscope where we put basically a small tube with a camera on the end up the horse's nose and look at the back of the airway. So on the camera there in that picture on the right-hand side is the throat of a horse. That little hole in the middle is going down into the trachea so that the horse can breathe, and lots of different things can go wrong in the airway of a horse, and the best way that we can look at it is with these endoscopes. This is a picture of a horse on a high-speed treadmill. Often the problem that a horse presents with is something that happens during exercise. Maybe that they are performing poorly. They used to be able to run really fast, and all of a sudden they can't run quite as fast as they used to. Or sometimes they have a bloody nose when they run or a snotty nose when they run. Maybe a heart problem when they're running really fast. And so to best emulate or replicate what happens in the real world, if we can't go out and exercise them, we can put them on a treadmill and monitor their heart, and look at their respiratory tract with the endoscope all at the same time while they're on this treadmill.
We have another question.
Great.
I'm going to jump in there. They want to know, you've talked several times about doing surgery on these horses, and they want to know, since the horses are so large, how do you do that? Are there special tables and rooms specifically for them? How does it happen?
Excellent. So great question is about surgery. So I myself am an internal medicine person, so my goal is always to avoid surgery if I can. But certainly surgery is another specialty in equine medicine that is incredibly important. And I have a couple pictures coming up soon that's going to show you exactly how we put a horse on a surgery table and how that process happens, because certainly a 1,500-pound horse is a big deal. So I'll show you pictures in a minute if you can hang tight.
Perfect.
Great. Okay, this next picture is a horse getting a blood transfusion because of maybe trauma where they lose lots of blood, or diseases that cause blood to be lost. We often have to transfuse horses with blood that comes from other horses. So this is an example of that process happening. So I just want to talk about a couple of case examples. I have, to protect the innocent horses, changed the names of these horses, but these are real life cases that have come into our hospital over the last couple of years. And the first one is, may the horse be with you. This is a racehorse. He's the one there in the back that has the jockey that's wearing red. And he used to be a fantastic racehorse. He was winning everything. And then all of a sudden, as you can see in this picture, things weren't going quite so well, and he wasn't performing nearly as well as he used to be. This is a little bit of a tricky thing when we think about veterinary medicine, because how do we figure out what's going on? He can't tell us what hurts. Is it one of his legs? Is it his heart? Is it his respiratory tract? Or maybe it's his stomach. If you had a stomach ache, you wouldn't really want to run as fast as you used to either. So it's hard to know sometimes what's going on. But certainly a common problem is that their stomach is bothering them, especially in a racehorse, that they are really stressed and they can get what we call gastric ulcers, just like you or I can, from stress. So again, what we can do is a gastroscope. Basically put a camera into their stomach and take a look at what's inside their stomach. So the picture on the right shows a man with a gastroscope. That tube is going up his nose and down into his stomach. So here's a better picture of that the tube goes into the horse's nose, down the esophagus, and into the stomach, which is sitting there at the end of the esophagus. And so we can get that camera in there and see what's going on. This is a picture of a normal stomach of a horse. There's two different types of tissue in the stomach of a horse. The bright pink stuff in the bottom right-hand side of the screen is the part of the stomach that really does the job. It makes acid that's important for digestion, and it also makes bicarb, which counteracts that acid and protects the stomach from getting disease. The light pink part of the stomach there at the top left part of the screen really doesn't have a job. It doesn't make acid, it doesn't make bicarb, and for that reason, it doesn't protect itself. And so that line right between the bright pink and the light pink part of the stomach is a spot where we sometimes can see gastric ulcers. Here's the stomach of May the Horse Be With You. And you can see that it's a little bit of a different image, but the bright pink part is at the bottom and the light pink is at the top. And you can see all of those irregularities of that stomach that are really, really irritating to this horse. And so as the horse is running and that acid from the bottom is bouncing onto those ulcers, it's really quite painful. And there are medications that we can give the horse to make those go away and make them better, similar to how you or I, if we had ulcers, would have some medications to alleviate some of that pain and heal those ulcers. This is Mama. She was a 10-year-old quarter horse mare that presented to us in labor. She had been bred the year prior, and the gestation length of a horse is 11 months, so a bit longer than people. And she was having some difficulty on her own getting this foal out. So here we have you kind of starting to think about how we can lay down a horse. This horse is down on the ground, but on some mats. So those big blue squares are some nice padded mats. And the veterinarian in this picture is trying to get the foal out to the best of her ability. It's sometimes challenging. A 150-pound little girl trying to pull out a foal that's probably about 150 pounds can be hard. And so sometimes we have to use things like chains and different types of devices to help pull the foal from the mare. And in that case, we did. And the little foal from mama was a little bit sick at first. This is the foal on the bed for the first couple of days of life. We had to support lots of things. Her front legs are wrapped up, as you can see, and that was because those legs were developed crooked, which is part of why she had a hard time coming out. You can see that there's a line running to her nostril there, her nose, and that was giving her some oxygen to support her and help her become healthier with time. Here we are a couple days later. You can see a little bit better, sitting up. The wraps are off the front legs. Still getting a little bit of oxygen for support, but within no time, this foal was up and at 'em and back with mom and happy and healthy. Not all of our patients are brown. This is one of our foals that came to us a couple of months ago, and this one had stripes. So part of equine internal medicine is sometimes seeing exotic animals, and this little zebra foal, similar to the foal in the last picture, had a little bit of a hard time at birth. Her mom didn't make it, and this foal was an orphan zebra for several months of life, and finally went on to find another zebra friend to frolic in the fields with. I mentioned earlier some diseases that are spread by insects, and the mosquito is one of those that we think about very commonly. Certainly here in Texas in the fall, we have lots of them, and they spread diseases like West Nile virus. This is something that horses can get. It's also something that people can get, so a really important condition. When your mom says to spray yourself with bug spray, she's serious, and you should listen to her. But horses are probably much more prone than people. We don't think about it in people quite as much as horses. And this is a horse that presented to us with West Nile virus. The horse's name was Bugsby, and the horse could not stand up. That the front legs, you can see in that picture, they're working pretty well, but this horse could not get its back legs up because of the neurologic disease that West Nile virus can cause. It affects the brain, it affects the spinal cord, and for that reason, the horse was unable to stand. So just like the picture I showed you before of the horse, we put this horse in a sling and helped support it and keep it standing for several weeks while it was getting better, and again, this horse went on to do just fine.
So I have a question back about your zebra.
Okay.
They'd like to know, is the anatomy and physiology of zebras, donkeys, mules, is it all the same as that of a horse?
Yeah, great question. So it is pretty much the same. There are some small differences. I mean, the obvious things would be that the ears of a donkey are huge, but that doesn't really matter when we think about veterinary medicine. There are some diseases that affect donkeys differently than horses. Parasites are a little bit different in donkeys than there are in horses. But really, they're very much the same. I think the biggest difference I could come to mind would be sedation and drug doses. Medication doses are a little bit different. So we know obviously much more. There's lots of research about horses, less so about donkeys, less so about zebras. We often use medication doses for the horse when we treat donkeys and zebras, right or wrong. It may be that we have to use a little bit less or use a little bit more, and sometimes we don't know the answer because of the lack of research. But by and large, a horse vet can do a pretty good job with a donkey and a zebra.
Thanks.
Yeah. Okay, this is Buddy. This is a really special patient that got his picture taken with the whole group. So this is the internal medicine service group that I talked to you about earlier. And this little foal, when he came to us initially, he was about 2 months old, and he was found kicked by his mom in the field with some pretty significant head trauma. Here he is actually when he got to us. So the picture on the left with the whole group was him going home and everybody celebrating. But this is really where we started, that he was unable to stand, he was unable to eat, he was not breathing well on his own, and he had to be on a ventilator. And he was a very sick little foal. The swelling and the trauma around his brain was such that we really needed to recruit help and support from other services and other veterinarians with specialty. So we talked to the equine surgeons, we talked to small animal neurologists, we talked to neurologists of human patients and pediatric neurologists to help decide that the best thing for this little foal was to get brain surgery. And he went in, and the surgical team of veterinarians, small animal veterinarians, large animal veterinarians, and human surgeons performed brain surgery on this little guy. And as you can tell from the picture on the left, he grew up to be a nice little foal and is now an adult horse doing fantastic. So a good story that shows that none of us can do anything alone, and collaboration and working with our colleagues is really an important part of what we do in specialty medicine. So coming back to other specialties, the question that we received earlier was, what else can we do? And is surgery one of those things? Absolutely. This is a horse on a surgery table. So you can see that table is similar to what we might see in human medicine, but 10 times bigger. That it's a nice padded table at a level that the surgeon doesn't have to bend over and get a sore back while they're doing surgery. Sometimes these surgeries can go on for 2, 4, 6, 8, 10 hours. So having everybody comfortable and safe is important. How do we get the horse on the table? I think it doesn't show the next picture. So the next slide, I'll show you a picture of how we get it on. So sometimes the horse is laying on their side, depending on where the surgery is being performed. The picture on the left is a horse getting surgery on its head, and so the horse is on its side. The picture on the right is a horse getting a surgery on its stomach. So it had a twist of its GI tract. And so the horse is laying on its back, and the surgeon can open up the abdomen that way and see everything that's inside the abdomen. So how do we get him on that table in the first place? We don't pick him up. Nobody's that strong. But we have a hoist that hangs from the ceiling and has the ability to lift up to 5,000 pounds. And we put what we call hobbles around all 4 of the limbs of the horse, pick them straight up and lay them down on the table. So we slide that table, you can see there's wheels, slide the table under the horse and then drop them back down. We do that with the help of other specialties. So the surgeons are certainly involved, the medicine people sometimes are involved, and we also have anesthesiologists that are specialized in keeping a large 1,500-pound horse in a plane of anesthesia or under anesthesia for the duration of the surgery. As you can imagine, if that horse started to move or wiggle or kick on the table, that could be a really big problem. So having a good anesthesiologist that can keep that horse asleep for the duration of surgery is very important. And here we have an anesthesiologist in the picture on the right that's monitoring lots of things, the heart rate, the blood pressure, keeping IV fluids going to this horse constantly so that everything stays happy and healthy and the anesthesia is successful for the duration of surgery. Pain control would be the other big thing, that we don't want the horse to feel anything.
So I have another question. We're going to jump back to your case study.
Okay.
And the student says that they've read horses must be standing or walking to have proper circulation. How do y'all make that happen when a horse has to be in a sling?
That's a great question. You guys are smart. The question is, they need to be moving and walking around to maintain circulation. That's certainly an important thing, that they have lots of muscle, way more than any human, for sure. And so how do we keep that circulation going if they're in the sling? That's something that we really struggle with, is making sure that there's not too much pressure on any single part of their body, making sure that they're moving around a little bit. We try to give them some physical therapy several times a day to move the legs and move things around so that they are maintaining proper circulation and getting up and moving to the best that they can. Obviously it's limited, but it's that physical therapy that's really essential.
That's great. And interesting that horses have physical therapists as well as
it's part
other
of the
types of doctors, right?
Yeah. Okay, other things that veterinarians might specialize in when we think about the horse is radiology. So a radiologist is someone that would look at x-rays, MRIs, CTs, and figure out from those images where the problem might be coming from. This is another horse that's under anesthesia. It's a little bit hard to tell what's happening in this picture, but the horse's head is to the right of the picture. Its tail is to the left, and you can see it kind of hanging over the side of that table. And its leg is in the MRI unit. So they're getting a good MRI of all of the structures of the foot of this horse. And here's what that looks like, that we can see the bone and all of the soft tissue structures within the horse's foot and tell if there's anything going on. Radiologists are specialized in looking at these images to know, is there something that's abnormal or not? Just for comparison, I threw in an x-ray. You can see that there's a lot of difference in the foot x-ray of a horse compared to the MRI. So different things that we might be looking at with one or the other, and reasons that we might pick one or the other. Certainly an x-ray is something that's easy to do. Field veterinarians do it all the time. The MRI involves anesthesia, putting them on the table, and often a radiologist to look at those images and tell what's going on. So some differences in how those things look. Another specialty that we think about as being important to help all of us do our job and do it the best that we can is the pathologist. Pathologist can look at blood samples. That's the picture on the left, is a sample of blood under a microscope to see what the cells look like and what types of cells are there. Is there anything abnormal? Sometimes parasites can be found in the blood cells of a horse. So they are specialized at looking at these things all day. That's what they do. The picture on the right is a biopsy sample of part of a horse's brain to tell if there's something abnormal with the brain itself. Often this is done, if we think of a pathologist, they often do what we call a necropsy, which is similar to an autopsy that we see in humans, that sometimes we don't know why a horse might have been found dead in a pasture or had a disease that we never really figured out what's happening. And the pathologist can help us answer those questions and get to the bottom of doing an autopsy or a necropsy exam. Another really important part of what we do is research. So our goal is always to be better and figure out better ways to do what we do. Researching the different topics that are important to the health and welfare of the horse so that the future looks brighter. A couple of different, and there's thousands of different things that I could have talked about, but in the interest of time, I found some ones that were interesting to me and to the future of the horse. And one of those is vaccine development. So someone asked earlier about what kind of vaccines are important and essential to the horse. And we have a core now, but ideally we're going to have way more and better ones in the future. As I mentioned a couple times, West Nile is one that's new to the horse population as of 1999. Before that time, the horse in our mind didn't get West Nile virus, and certainly we didn't have a vaccine. Since then, there's been lots of different vaccines that have been developed, and every time we get a new one, it's ideally better than the one before. So we're doing a really good job with vaccination preventing this disease in our horse population. Equine herpes virus is a condition I haven't mentioned. There's lots of different herpes viruses. This is different than herpes virus that affects people. It's the same family of virus, but it's not the same. You can't get herpes from a horse, and horses can't get herpes from people. But there are vaccines that can help prevent the spread of that disease in the population as well. And similar to West Nile, with time, we've gotten better at creating and developing these vaccinations. Rhodococcus pneumonia is another condition that's important to horses. It's the most common cause of pneumonia in foals and often causes death on big breeding farms of these foals. Nobody to date has developed a vaccination, but there are researchers here at Texas A&M, Dr. Noah Cohen, that is working toward development of this type of vaccine. Rabies is one, again, that I mentioned before. It's an essential vaccine to the horse population, and the reason for that certainly is to keep the horse safe, but it's also a disease that could be spread from horses to people. It is fatal to horses, it's fatal to people, so we certainly don't want that zoonotic spread from horse to people of disease within our population. So preventing that disease is also really very important. And then I think I mentioned earlier, influenza is another condition, the flu, that can happen in horses. It has similar signs as it does in people, different strain, but we can again help prevent spread of that disease with vaccination of our horses. Other topics of interest in equine research, management of natural disasters is one that came to mind now with all of the wildfires out in California. So trying to figure out how to better manage these patients that are in the depths of natural disasters such as fires. Floods is one that's hit the state of Texas recently with Hurricane Harvey last year. Our hospital admitted over 60 horses that were stuck in water for days at a time. And the effect of that is that they lose their skin in all of the areas that are soggy and wet and have been in the water for some duration of time. And so figuring out how to better manage these patients after these natural disasters and after traumatic events like a tornado is very important. Another condition that may be something you've heard about even if you're not familiar with the horse is laminitis. And many of you may recognize this racehorse. This is Barbaro, who won the Kentucky Derby many years ago. But during the next race that he ran, he had a catastrophic break of his leg. So he broke his leg, he went to surgery. Lots of spectacular surgeons at the University of Pennsylvania worked on them. And you can see there's lots of different screws and pins and plates that went into repair of the break of this horse's leg. So another example of where a horse could utilize the sling, they had him in a sling to help support that leg that was broken. The broken leg is the one it's that right hind leg that you can see wrapped in the white bandage. But he also has a bandage on that left hind leg, and the reason for that is because he was putting so much weight on the left hind leg, it developed what was called laminitis. Here's a picture. The x-ray in the middle there is an x-ray of a normal horse's foot. There's the bone there at the bottom, and then the hoof capsule that goes around it is really an important structure in the horse. What happens in laminitis is the hoof capsule basically becomes detached from the bone, and the bone sinks through the bottom of the horse's foot. To me, it's an extremely painful thing, and I always say it's kind of synonymous or similar to if you were to take a hammer and slam your fingernail with the hammer and then try to walk around on that finger. That's how painful this could be. Unfortunately, Barbaro didn't survive as a result of the effects of laminitis, even though the repair of that fracture was quite well done. So lots of research. We don't know why this happens in horses. Lots of different theories, lots of different possibilities, and tons of people out there trying to research it and figure out how we can stop this from happening.
So they have a question about that.
Okay.
And they'd like to know, can a horse recover from a broken leg?
It certainly can. We kind of talk about in general that if a horse breaks its leg, there's nothing we can do. But certainly that's not necessarily the case. If Barbaro had not ended up getting laminitis, he would have gone on to be a happy, healthy horse. Now, could he continue to race in the Kentucky Derby? Absolutely not. He might be comfortable, happy in a pasture, eating lots of food, and getting lots of love and care. Probably not a performance horse. We in our hospital at Texas A&M do a fair number, not me, but some people, do have an expertise in repairing of fractures and breaks of the horse's leg. So it's something that's possible. It depends on the break. It depends on where it is. It depends on the temperament of the horse sometimes, that they have to be compliant through a long duration of healing. Great question.
Thanks.
So the last piece of what I do and what an equine internal medicine specialist might do is education. Certainly that might look like teaching veterinary students that are becoming veterinarians themselves. They might go on to do private practice. They might go on to do regulatory or government work. They might want to become researchers. So educating those veterinarians in the first, second, third, and fourth year of their veterinary career is certainly an important part of what we do. We also teach other people. So interns and residents come through our hospital that want to become specialists in internal medicine, and clients as well. That the owner of this little horse, Buddy, that I talked about earlier, had to learn a lot about the disease that was going on in her horse, what the future looked like for this horse, and how to manage the future, how to properly feed him, how to vaccinate him appropriately. So client education is really important. And I guess I'll finish by saying, doing things like this, that there are lots of young students like yourself out there that have interest in veterinary medicine, interest in equine medicine, and educating you about how to get there and how to do what you want to do is really an important thing that we can all do. And with that, I'm happy to take any more questions.
All right. Well, we do have one more question. It's a tough one. You ready for a tough question?
I don't know. They've all been tough.
So they want to know, as a veterinarian who's pledged to protect animals, and particularly horses, what are your thoughts on equine slaughter?
Oh, wow, that is tough.
One.
So the thoughts on equine slaughter, that is something that I think it was 2007, this country decided not to do equine slaughter, that we do not slaughter horses in this country anymore. After that time, and I guess I've had I started my veterinary career in 2007, so it was right about that time. I don't really have a good knowledge base of what happened before 2007 in this country, but certainly what we saw in 2007, 8, 9, 10 was a huge number of horses that were starved. that the outcome was starvation of horses. And so for that reason, certainly we don't like to see animals suffer. And so is slaughter a better option for these horses? Potentially. You know, do I have the right answer? Do I advocate for slaughter or not? I don't think so, but certainly there is a downside that we do have a lot of starvation as a result of the closing of the slaughter plants.
All right, good question. We'll end on a more fun one.
Good.
That's a tough one. They want to know, what's the most interesting case you've gotten to work with?
The most interesting case. Sometimes it's not so much the disease, it is the horse. That there are sometimes horses that are just extra special. We love them all equally sometimes, but then there's some that just really hit home as being extra special. And one that comes to mind is a horse that pulled a cart for parades, funerals. It worked a lot in funerals, pulling the carriage that might carry the casket. This horse was in Georgia. It got transported to Texas, and when it got home, it was really very sick, and no one could figure out why. It turned out it had really very bad pneumonia, and it was in our hospital for about 8 months recovering from the effects of pneumonia. So probably why he was so special is that we spent lots of time with him. He was just the best patient in the whole wide world, that he let us do anything, and he was just a good boy. And as soon as you walked into his stall, he always wanted treats, and was just a good horse. So that one really sticks out in my mind always. I have a stuffed animal that is a replicate of him, so he really is a special little guy.
All right. Okay. Well, that's about all the time we have for today, and we so appreciate you being with us today. We appreciate Dr. Coleman for joining us and sharing so much insight into this profession and all the opportunities it entails. If you'd like to learn more about equine medicine or veterinary science or other STEM-related topics, we encourage you to visit our website. It's peer.tamu. And we thank you for joining us. This is actually the end of our webcast series this semester, and we look forward to seeing you next semester. Until then, enjoy your holiday season and keep learning. We'll see you next time.